The CARTITUDE-4 study is a phase 3 randomized studies where patients with relapsed refractory myeloma, 1 to 3 prior lines of therapy, and lenalidomide refractory myeloma were enrolled. And actually 419 patients were enrolled in the study and were randomized to receive either a standard of care treatment until progression, consisting of, at physician's discretion, a combination of daratumumab, pomalidomide, and dexamethasone, or pomalidomide, bortezomib, and dexamethasone, or the experimental arm, which consisted of at least one bridging cycle above the two options, DPD and PVD, then lymphodepletion, and a single infusion of Cilta-cel followed by observation only. The primary endpoint of the study was the progression-free survival, which was met. Patient in the Cilta-cel arm had a lower risk of progression or death, and this was already published last year in 2023 in the New England Journal of Medicine. And among key secondary endpoints, also patient-reported outcomes that we presented at the last EBMT with a median follow-up of 15.9 months. Among the PRO, we evaluated several domains through the Euroqual URTC QLQ questionnaire C30, assessing several domains, functional domains, symptoms, and also global health status, the Euroqual 5 dimensions, 5-level assessment, and the MySimQ questionnaire. So what we observed is that the global health status improved to a clinically meaningful improvement at month 12 in the Cilta-cel arm, while it remained stable in the standard of care arm. We assessed several functional domains such as emotional, physical, role, and social functioning. All these domains improved, all the scores pertaining to these domains improved in the Cilta-cel arm, while they remain stable or slightly decline in the standard of care arm. Pain scores improved in both arms, but improved to a greater extent in the Cilta-cel arm, reaching a clinically meaningful improvement at month 12 as compared to the control arm, in which the improvement was not clinically meaningful. Fatigue worsened in the standard of care arm, and instead in the Cilta-cel arm, starting from month 3 onwards, we observed an improvement in fatigue as well. And where patients were asked to rate their health through the visual analog score, which is a self-rate tool, they reported an improvement in their general health throughout the study up to month 12, where we observed a clinically meaningful improvement as compared instead to the control arm, where the same scores remain basically stable. So overall, we observed an improvement in global health status, an improvement in the perception of their general health, and improvement in several domains such as emotional, functional, social, role, and physical functioning, as well as in pain and fatigue for Cilta-cel over the standard of care arm, while the same scores remain stable in patients treated with DPD or PVD. So altogether, these results, along with the already positive results in terms of responses, minimal residual disease negativity, and prolonged progression-free survival, reinforce the use of Cilta-cel as a potential new standard of care for patients with myeloma who's refractory to lenalidomide after at least one prior line of therapy.